The rotator cuff is a group of 4 muscles that surround and support the shoulder joint. They are the supraspinatus, infraspinatus, teres minor, and subscapularis. Let's take a look at the right shoulder. There are 3 bones that make up the shoulder. You have the humerus, the scapula, and the clavicle. The shoulder joint is also called the glenohumeral joint. It is a synovial ball and socket joint that allows a wide range of movement. There is articulation between the head of the humerus and the glenoid fossa of the scapula. The rotator cuff muscles help to keep the head of the humerus within the glenoid cavity. There are 2 important landmarks on the humerus. You have the greater tubercle and the lesser tubercle. These are bony prominences on the humerus which act as the insertion point of various rotator cuff muscles. First we have the supraspinatus muscle, and it's called this as it sits above the spine of the scapula. It inserts onto the greater tubercle of the humerus, and it functions to abduct the arm from 0 to 15 degrees. Next we have the infraspinatus muscle, which again is named as it is below the spine of the scapula. This also inserts into the greater tubercle, and it functions to externally rotate the arm. Moving on, we have the teres minor muscle, which originates along the lateral border of the scapula. Teres minor is the 3rd and final rotator cuff muscle that inserts onto the greater tubercle of the humerus. It functions to externally rotate the arm and also to adduct the arm. Finally, we have the 4th rotator cuff muscle, subscapularis. This muscle originates on the anterior aspect of the scapula within the subscapular fossa. It inserts into the lesser tubercle of the humerus, and it functions to internally rotate the arm. A common mnemonic used is sits, where the rotator cuff muscle sits on the shoulder. The first 3 muscles, supraspinatus, infraspinatus, and teres minor, insert onto the greater tubercle, and the final muscle, subscapularis, inserts onto the lesser tubercle.